Hi, I'm Congressman Mark Takano, Chairman of the House Committee on Veterans Affairs. One of the top priorities for my office and for the committee is to reduce veteran suicide. Veteran suicide is a national public health crisis that too many veteran families have had to endure. For my own family, it was my uncle, a Vietnam veteran who died by suicide. I still remember the day I came home from school as a 10-year-old boy to learn he had died by suicide. His death has left a lasting mark on me. Currently, 17 veterans, reservists, and National Guard members die by suicide each day. We have an urgent need to address veteran suicide, but it must be done with sound, evidence-based policies that have been proven to work. And that is why the committee adopted a holistic 7-pillar framework to address this issue. These pillars consist of strengthening economic supports, strengthening access and delivery of care, creating protective environments, promoting connectedness, teaching coping and problem-solving skills, identifying and supporting people at risk, lessening harms and preventing future risks. By addressing factors like housing insecurity, expanding emergency mental health care access, and addressing the safety culture at VA facilities, all of which can affect a veteran in crisis, we can achieve smart, meaningful change that will reduce veteran suicide. Many of the veterans we've lost to suicide would still be here today if they had access to the care they needed. That is why I introduced the Veterans Access Act. The Veterans Access Act removes financial barriers many veterans face when accessing emergency mental health care. This bill authorizes VA to pay for or provide emergency mental health care for any veteran regardless of their eligibility for other VA benefits, regardless of their enrollment status, regardless of their service connection, or regardless of their discharge status. This bill also requires VA to notify suicide prevention coordinators at the nearest VA facility to a veteran in crisis so that appropriate follow-up services can be facilitated as needed. This bill will improve care for veterans in crisis and relieve them of the financial distress that may come from seeking emergency mental health care. Let me be clear. The Access Act is a meaningful solution that builds upon the 15 bipartisan bills that already have passed out of the House. I hope my Senate colleagues will act on these bills soon. I'm also eager to work on the intriguing proposals that are pending before Congress. Our work is definitely not done. I will continue working with the committee and to make sure all VA staff are trained and that all facilities are properly equipped to take care of those who defended our freedoms. My staff and I will also work to ensure these requirements extend to community providers as well. As we look for additional solutions and innovations to reduce veteran suicide, particularly among those who are not currently using VA, we must remain vigilant to ensure that our approaches are effective.